And recently, there has been number of the disturbing news coming out of Islamic Republic of Iran that the government of Islamic Republic weaponizing medicine as a tool to change the health and healthcare in Iran by denying medicine, vaccination, and some other way of which might even be considered as genocide. Before we get to that narrative, I will discuss with you some of the dark part of the history that the medicine has been weaponized or the medicine has gone under ideology or political ideology in order to exert or practice some means of governmental control. The first part, which was purely research, however, represented the lack of respect for human life, was the Tuskegee project in the United States, where the contracted patient with syphilis in Tuskegee, they left untreated. Even after the penicillin was invented, they were not given the penicillin in order to review the uh, natural history of syphilis. 400 black men were involved in this until their death, that some of them after penicillin could have been treated. In any rate, the same research was done in Guatemala uh, for the same disease, syphilis, with some of the foreign government. Although the United States really, this was a shame part of their history. They have to rectify it. They have to compensate. A number of the compensation was done to the families and to the relatives of the contracted men, and they have done a number of the issue to compensate for this. The apology from the different organization has been issued. So nationally, that has been rectified and has put behind them. Another issue that is very dominant is the issue of the Nazi in 1940s when Hitler, under the hygiene of health or hygiene of gene, uh, initiated a project called Eugenics, and this is when they try to identify uh, individual with heritable diseases or some of the genetic diseases, and they were put them to death in order to purify the race, the Aryan race or German race. In any rate, this is above and beyond uh, the Holocaust that they killed millions of the Jews for the same reason. Basically, the eugenic project, as has been reported, is probably there were more than 300,000 children were killed in that category. The other historic and dark part of this part is the Chernobyl in Russia, when the meltdown of the nuclear uh, facility occurred, and more than number of the people dead, and more than 400,000 or to one stories 4 million were contaminated, and the rate of the cancer increased in there. And at that point, even the medical surveillance was not done. Uh, the other medical atrocity under the ideology is the issue of the Uyghur population in China, where this Muslim population being castrated by physicians, and this is another dark part of the medical history, weaponizing medicine. There are some other examples in the world. that I have put an essay together, and we will publish it in alirahimibooks.com. However, I thought this is the part that we can discuss in detail here. Now we are going back to Islamic Republic of Iran. Islamic Republic of Iran has done number of the weaponizing medicine in order to curtail the medical care, meaning that by creating environment of hardship for the physician with regard to their coverage, with regard to the clothing, with regard to their social freedom, and many of them have fled the country. The medical school and all the university were closed for 3 to 4 years. As such, there was interruption of the medical care. There are shortages of physicians. Recently, a report came out of Iran that there are 120,000 shortage of the nurses. The hospital has not been modernized. The medical care is very dismal. The COVID story was a national and international issue when Ayatollah Khamenei ordered not to let or import Moderna or Pfizer vaccination. There were some Chinese and some Russian vaccination for COVID that they let come to the country. However, that was not even cover half of the country. There are different numbers reported, but based on the information from Iranian, there has been more than 200,000 deaths in Iran and maybe more. One recent story that is very heartbreaking is the story of the papilloma virus. As we know, the papilloma virus is a genital the virus that is contaminated through the sexual activity, multiple sexual activity in the younger age. Most of the papilloma virus in the world has been contained in the United States by vaccination. The papilloma the virus has been associated with the cervical cancer almost 99% of the time. This is a very strong association, and all the vaccination has been effective more than 90% of the time. The Western country, all over the world, those countries that are in relationship with the Europe or America has received the vaccination. However, the Islamic Republic does not let vaccination enter. There are a number of the reasons. One is they said they have to produce it within Iran. That's one, that they haven't been, and there is one, and even that has not been distributed, or there are some shortcomings from the formulation point of view. The other one is the ayatollahs in the higher places, or when they issue fatwa, they have done this to not to general use, because they think if it being general use and given to all the girls under 20, promiscuity going to be increases and they're going to get involved in the sexual activity. However, there has been reported that more than 41% of current total population of women in Iran are positive for papillomavirus when they are tested. The number of the issue involved in this is not that the Iranian girls are involved in sexual activity. They are. However, there are some other reason. For example, The child marriage in 2017 to 2020, there was 184,000 child marriage that the girls were married. They were 15 years old. Since the 2020 and 2022, the age of the marriage was dropped to 13, and then in some states, in some provinces, to 9. There is this concept in the Shia called the Sire, which is a temporary marriage. And recently, the government of Iran has issued decree that any foreigner, particularly they are talking about the Arab neighbors, enter to Iran to work, and if they married a young girl, the age of marriage for that is for the Sire is 9 years old. They can become Iran citizen. So, and then there are a number of the organization by the name of Paradise, which is a brothel, the governmental brothel, and they call it they are named under different Paradise and Paradise One and Paradise of Flowers. That the girls under 20 they are engaged in this temporary marriage, and they call it halal prostitution. Uh, and that's one of the reason that this issue has surfaced, and this atrocity has been done to the point that many of these girls, many of these women, that 41% of the total population, that they are positive for papillomavirus serology, they eventually going to get cervical cancer. So it's going to be a health burden, it's going to be a population burden, and it's going to be abuse and atrocity towards Iranian. Uh, if you search these and go to the different countries, many countries contain the papillomavirus, but Iran does not. So that's a big question. The ideology, weaponizing medicine, the medicine become part of it. The physician, whether they fight, that's another story. But we have heard the number of the physician that has fought has been punished severely, and many others also do not advocate. Uh, so the history now is repeat itself. We have doctors that killed in Nazi. We have doctors that was involved in the syphilis research. We are physicians that they were involved in not adequately treating the victim in the Chernobyl, and also many of physicians in China that involved in the castration of the men and the women surgically, and now the mullahs that weaponizing medicine for another genocide. The world is really should be concerned about these atrocities.